Alright, good morning. This is Robert Hill with Golden Years at Home Care, and today we're going to talk about dementia. Some of the symptoms, what it affects, exactly what it is, and some of the treatments and the testing about it. So, first thing we're going to take a look at is the medical definition of dementia. Now, dementia is a loss of brain function that occurs with certain diseases. It affects your memory, your thinking, your language, judgment, behavior, pretty much everything. Dementia symptoms include difficulty with many areas of mental function. This is to include your language. All of a sudden, instead of being able to make sentences, it can be gibberish out of anything out of the ordinary. Stories will be made up. Memory. Individuals I've seen couldn't even remember what they were saying mid-sentence. All of a sudden it just cuts off and they're not really sure what they were saying. Their perception on things, emotional behavior and personality. The individual won't exactly act like themselves. They may be grumpier, comments may be more inappropriate, whatever it may be. And there's also your skills as far as your calculation, abstract thinking, judgment, reading, and such. Usually dementia starts with forgetfulness. You'll notice things like individual may not memorize or remember their way home, or it could be anything as far as like putting mail in the fridge by mistake, or I'm not saying if you've done these you're automatically a dementia candidate. There's testings and everything to go through it, but these are just some of the things that are associated. It all starts with forgetfulness. Now, mild cognitive impairment is a stage between normal forgetfulness due to the aging and the development of dementia. So people with MCI, which is a mild cognitive impairment, have mild problems with thinking and memory that do not interfere with their everyday activities. They're often aware of this forgetfulness. Not everyone with a mild cognitive impairment develops dementia. As we get older, sometimes our memory does tend to elude us just a little bit. Now, symptoms of mild cognitive impairment can include difficulty performing more than one task, multitasking, frustration with multitasking, to where you may have been able to do it before, but now all of a sudden you can't do it. Difficulty solving problems or making any decisions. Forgetting recent events or conversations. I mentioned earlier in the mid-sentence they could be talking about, can you pass me and then they forget that they were talking about the salt and pepper shaker. Taking longer to perform more difficult mental activities. That is also another sign of mild cognitive impairment. Now, early symptoms of dementia can also include anything that takes thought, any things you got to think about, things that used to come easy, such as maybe balancing checkbooks, playing games, any game, Scrabble, Uno, whatever it may be. All of a sudden it's becoming difficult now. You can't do it. Getting lost on familiar routes, like we talked about, as far as if you're on your way home and all of a sudden you have no idea where you're at. Language problems, such as trying to find a name of familiar objects, ketchup, mustard, whatever it may be. Losing interest in things that you used to enjoy, a flat mood. All of a sudden, you don't want anything to do with reading or whatever it may be. Misplacing items, personality changes, and loss of social skills, which can lead to inappropriate behavior. Usually there's a heightened level of anxiety, of anger, and because the individual doesn't exactly understand what is going on. As dementia becomes worse, symptoms are more obvious and can interfere with the ability for that individual to be able to take care of himself. Can include change in sleep patterns as far as waking up at night. What happens is the individual is losing track of what's day and what's night. So when they're waking up at night, they start thinking, okay, it's morning. And they start to get confused. Their whole biological clock starts to kind of get messed up. Meal preparation, proper clothing, driving. After certain levels, individuals with dementia can't no longer prepare their own meals. They can't drive anymore because uh, their mind just, they'll be more prone to leave a oven on, a burner on, or they'll get into more car accidents. Current events we've already talked about. Forgetting events about current events. They might not even know who the president is. That's one of the questions I'll ask. A physician will actually ask in a dementia, test. Forgetting events about even their own life history. Losing awareness of who they are, who you are. If you're their brother, their mother, their father, whoever, and all of a sudden you go to talk to them and they don't recognize you from day to day. These are just signs that the dementia is actually starting to worsen a little bit. Hallucinations, arguments, striking out, violent behavior. The individual's already frustrated. They don't understand what's going on. They're they're mad and angry. They can't even finish a sentence. Delusions, depression, agitation. Sorry, just one moment. Poor judgment, more difficulty reading, using wrong words, pronouncing words incorrectly, story making up. I'll say earlier, I talked to the Queen of England and such and such, and they may carry on with different stories. Withdrawing from social contact, they no longer even really want to talk so much. They're kind of more in their own little world. Now, people with severe dementia can no longer perform any of the activities of basic living, eating, dressing, bathing. They no longer recognize any of their family, understanding language. I mean, it starts to get worse and worse. Other symptoms that may occur with dementia, swallowing problems and incontinence. So that gives a broad overview as far as the symptoms and from the mild dementia to the more severe dementia. Now the next thing we're going to go ahead and take a look at is the causes of dementia. Both types of dementia are irreversible. Irreversible, non-reversible, whatever it may be, means that the changes in the brain caused by dementia can't be turned back, it can't be reversed. The most common type of dementia is actually Alzheimer's disease. Lewy body disease is a leading cause of dementia in elderly adults. People with this condition have abnormal protein structures in certain areas of their brain. Dementia can also be due to many small strokes, is what they call them. This is more of what they call like a vascular dementia. Some of the other diseases that are involved or associated with dementia are also Huntington's disease, multiple sclerosis, infections that can affect the brain, HIV, AIDS, Lyme's disease, Pick's disease, progressive supranuclear palsy, Parkinson's disease. Now, we did mention there are some causes of dementia that can be are reversible, such as alcohol abuse, brain tumors, brain injury, changes in blood sugar, sodium or calcium levels, lower B12 levels than they're supposed to be. Certain medications, including, cimetidine and cholesterol lowering medications, can actually help with them. So these are just some of the, as far as the lost my train of thought. I'm sorry. Common causes as far as dementia goes. Now the next thing that we're going to actually look at is, okay, what do you do if you think you may have it? Well, the first thing you're going to want to do is go and talk to a healthcare professional. They're going to go ahead, a doctor. They're going to run you through different tests, B12 testing, as we mentioned, and they're going to ask you a history as far as, do you drink? They'll test your blood sugar and all these things. They'll also run through a group of questions, and some questions may seem simple, but just them ask questions, what day of the month is it? Who the president is. And when they do all this testing, it may take a little bit of time for your blood work to come back, but after all the testing is done, they'll be able to tell you about more as if you have it or if you don't have it. Also, there's treatments for dementia if you are diagnosed with it. There's from pills that you swallow to patches, and what it is it helps prolong your memory. It's not something that just falls off the edge right away. Little by little, your memory slowly starts to degenerate, and then as it progressively takes place, or if it's something that say was caused by low B12 levels, it can be reversible, so you'd be just fine. So if you have any other questions, we do thank you for watching this video, but if you do have any other questions, go ahead and go to www.goldenyearsfl.com, or go to or email me at goldenyearsfl@gmail.com. And we do thank you. God bless you and have a great day. Thanks.